Driving under the influence of hallucinogens, consequences, fines, and penalties, Part 4. DMT, dimethyltryptamine. Many plant species, notably the Amazonian ayahuasca plant, naturally contain this strong psychedelic. Additionally, it can be created in a lab. The second kind of synthetic DMT usually appears as a white powder. Typically, it is smoked with a pipe or inhaled with a vaporizer. DMT from plants is typically made into tea. DMT is another classic psychedelic that induces strong audio and visual hallucinations as well as a warped perception of space and time. The effects of this medication are strong, abrupt, and occasionally unpleasant. DMT use is frequently compared to a near-death experience by users. Similar to LSD, there is a high possibility for disturbing hallucinations, which is mostly dependent on the user's mental condition. DMT can jeopardize not just the mind but also your physical health by causing 1. Quick heartbeat 2. Elevated blood pressure 3. Chest pain 4. Having trouble breathing 5. Severe wooziness 6. Restlessness 7. Diarrhea, vomiting, and nauseousness, when taken orally. Mushrooms and psilocybin. Other names for psilocybin mushrooms include shrooms, magic mushrooms, and boomers. These mushrooms' main hallucinogenic ingredient is psilocybin, which gives them that effect. Typically, the mushrooms are consumed dried, raw, or brewed into a tea. The drug has effects that are strikingly similar to LSD's, but they are far more unpredictable because it is impossible to determine how much of the active ingredient is actually present in the mushrooms. The effects of this medication on a user could be good, including exhilaration, excitement, and enjoyable hallucinations. Or, it could be overwhelmingly negative, bringing on panic attacks, severe paranoia, and terrifying hallucinations. There are hundreds of species of deadly mushrooms growing in the wild, many of which resemble the non-lethal psilocybin mushroom extremely closely. This is one of the biggest risks associated with ingesting mushrooms. It could be fatal to confuse one mushroom for another. Even generally benign psilocybin mushrooms can have unpleasant physical side effects that might be incapacitating, such as nausea, vertigo, excruciating stomach aches, and diarrhea. This tiny, cactus-like plant contains the chemical mescaline, which has extremely strong hallucinogenic effects. To make the drug, peyote seeds are either boiled or soaked in water to produce an intoxicating liquid that is then consumed. Mescaline typically causes visual distortions, oral hallucinations, and in severe cases, the perception of non-existent objects. Additionally, users claim that this substance causes a dreamlike state when they are using it. Like with all hallucinogens, mescaline consumption can cause reality distortions that are either pleasant or unsettling. Other symptoms include nausea, headaches, and extremely high levels of anxiety. PCP, phencyclidine. This laboratory-produced dissociative psychedelic was initially developed as a general anesthetic for use in medicine. Typically, PCP is available as a powder, liquid, or tablet. It can be smoked with tobacco or marijuana or consumed orally. This narcotic may also be known as rocket fuel, superweed, ozone, or love boat when purchased on the street. The pain-killing properties of PCP can create a variety of distinct effects, most of which are accompanied by a sensation of bodily numbness or being outside of one's own body. PCP also affects mood, alters memory, alters how you perceive time, and produces visual hallucinations. Large doses of PCP frequently cause users to become violent, either toward themselves or other users. Along with dangerously elevated body temperature, lack of physical coordination, loss of muscle control, and in extreme cases, convulsions, the medicine also causes these side effects. Ketamine, often known as Special K, Ket, Vitamin K, Super K, and Cat Valium, is a dissociative hallucinogen. This last street name originated from the fact that doctors sometimes use ketamine as an anesthetic for animals. Although it is produced as an injectable liquid, it is marketed for recreational use illegally as a powder or tablet. People who use ketamine either ingest the tablets, snort the powder, or administer it intramuscularly. As a general anesthetic, ketamine lessens bodily feelings and imparts a numbing sensation all over the body. The duration of the effects can range from 2 to 3 hours, depending on the dose. Ketamine use can result in a range of outcomes, including 1. A situation akin to a dream in which the person feels cut off from their body. 2. A feeling of utmost contentment and relaxation. Confusion and a sense of being in over your head. Because the medication will impair their motions, muscular coordination, and motor skills, ketamine users run a high danger of getting hurt. Because ketamine completely inhibits pain signals, the user will be more likely to damage himself and less likely to notice. Chronic ketamine use can result in serious health issues, such as 1. Liver injury. 2. Kidney injury. 3. Disorders of the urinary tract and bladder. 4. Intense stomach discomfort. 5. Heart injury. 6. Permanent deterioration of both short and long-term memory.